The irony of the 60s phrase, never trust anyone over 30, rings loud and clear when, according to the U.S. Census Bureau, nearly 8,000 boomers are hitting 60 every day. And some are not choosing to age gracefully. The cosmetic industry is prepared for battle. Joining me today is Dr. George Bitar from the Bitar Cosmetic Surgery Institute and Dagmar Whitmer, one of his patients. Thank you both for joining us. Tell me, doctor, what are the most common procedures that you're asked to perform?
Well, we provide anywhere from non-surgical to surgical procedures for people who want to either have something done in a minimally invasive way or they can have something more involved. Minimally invasive could be anywhere from medical grade skincare to Botox, the muscle relaxant to get rid of the wrinkles, and Restylane and Radiesse to fill the smile lines and to plump up the cheeks or give nicer lips. Anywhere to facelifts, necklifts. I'm co-authoring a book on necklift techniques that is available to people who just want to get rid of improve their neck contour without having a full facelift.
I think we have an example sitting right next to you, a very lovely example. Dagmar, tell us about why you decided to have cosmetic surgery.
When I'm 62 and I decided I didn't really want a facelift. I didn't really mind my face, but I hated the neck, when it starts drooping, winkling a little bit and all of that. So I decided I was going to have my neck done.
And how long did this take before it healed?
Well, I had it done the week before Memorial Day. And on Memorial Day weekend, I already went to a party and everybody thought I looked wonderful. I wasn't even blue. He's so great. Mm-hmm. Everybody says eyes and whatever. He said no eyes. He will be fine. I said, well, how am I going black and blue? He said, don't worry about this.
Did you do this to advance your career or
no, just for myself. I just hated that wrinkly neck, and I'm so happy with my neck now. It looks natural. I had like a little bit kind of double chin or whatever you want to call it, wrinkles, and I just hated it. Yeah. So now I'm really happy.
Doctor, walk us through the procedure. Somebody knocks on the door, comes in and sits down, and briefly can you sketch out what happens? What's the procedure?
Sure. We have an elaborate preoperative involvement with our patients. First, when they make an appointment, our receptionist educates them on the phone, first of all, as to what is available and what we can do for them, in a brief way, obviously, before meeting them. And then when they come and make an appointment, they meet with my nurse, Pat Benign, who will discuss with them their options and show them before and after pictures so they get well informed. Then I meet with them and discuss with them the surgery and their different options. We show them, if we have someone in the office who's had a similar procedure, we'll introduce them to them and give them the option to talk to that person. We also give them references of people who've had the surgery, their same surgery, to call them up on the phone and talk to them. And then I allow the patient to go to their medical doctor for medical clearance. I think that their medical doctor should give the blessing before they undergo any surgery, because even though it's cosmetic surgery, it's still surgery, and we take it very seriously.
But could I interrupt you and ask you about a cost here? Is there a list and prices like for nose, ears, mouth?
There's a list of costs. Procedures, basically, the costs involved are the surgical fee, the anesthesia fee, and the hospital fee. I do my surgeries at the Innova Fairfax Hospital with board-certified anesthesiologists, so that is a separate fee. And the fee also depends on the person.
So maybe a nose for one person might be less expensive than for another?
Absolutely. One nose may be a very easy nose to do. Another nose may be a very difficult nose to do. One nose may take 1 hour and operate, another nose may take 2 hours.
What about insurance? Is that covered at all?
The insurance does not cover that, unfortunately, John, because this is cosmetic surgery, so it is fee for service.
Yeah. Well, what do you say to people who are concerned about this procedure? Because after all, they are working on, you'll be working on their face. Do they have an idea before what they're going to look like after? Do you give them a sketch or anything?
Absolutely. John, informed consent is not just a paper that you sign. It's a process that you go through. By talking to my receptionist, talking to my nurse, for me to discuss with them the surgery twice before the surgery, then meeting patients, then talking on the phone, seeing my website, and seeing before and after pictures, I think they get very comfortable before they go to the operating room exactly what they're going to be expecting.
Yeah.
And Dagmar can tell you, it's a very transparent process where there is nothing hidden, there are no secrets.
Dagmar, do you have some friends that have had cosmetic surgery for business reasons?
Yeah, oh, definitely. I have a casting agency, so a lot of them have plastic surgery done. But I think very few of them have their necks done. Everybody starts with the face and everything else, and I think the most important thing is the neck.
What about seniors? People over 50?
Seniors, oh my God, everybody now in my age group, they're all touching on with their face.
And does that help you get a job?
I think so. They look better. I think my neck definitely looks a lot better. And also Dr. Bitar put part of my chin in, so he made my chin look better than it looked before. And he decided to do it both at the same time. Since he's already at the neck, he might as well do the chin at the same time. So I think you enlarged it by 1 centimeter or something?
That's correct. We put a small chin implant that did not take any longer time. The whole procedure of a neck lift and the chin implant was about an hour and a half. And it was with hidden scars. So we do a special technique with a fibrin sealant that will start the healing process shortly. And as you can tell, she's a few months out. I usually tell people it takes 6 months to a year to see the final result. But early on, we see a real nice result.
Yeah, we certainly can see that here.
And I have no scar. I mean, the scars behind the ears you don't see anymore. I'm ecstatic.
Dr. Bitar, Dagmar, thank you. We've learned a great deal about cosmetic surgery today.
Thank you for having us.
Thank you. And before you decide to undergo plastic surgery, here are some tips you should remember. First, the